All right, guys. So after the cervical area, let us see something on the thoracic. So thoracic is this blue part. There are 12 vertebrae in numbers. All right. So for what purpose we use it? We are using it for mainly rotations. Okay. Not for flexion, not for extension. You must have read this in your notebook already, that it has very limited range of motion in the flexion, very limited range of motion in the extension. All right. And for that reason, let me just give you some support of evidence. Why there is no more extension? Because if you will see the design of the vertebrae, can you see this? How they are getting slanted, right? Because it is not designed to go back. And that's why it has little bit kyphotic curve here. You know, what is there? 1, 2, 3, 4, 5. And in front of the 5, 6, 7, 8, 9. If you keep it here like this, and you can easily see that in the front, it is heart and the lungs, right? God doesn't want that you keep on pushing on your heart and the lungs. So don't do these movements, okay? When you are laying on the wooden block and then you are trying to push yourself back, right? Like this, you're not going to get any opening. People call it like chest opening, heart opening, and I don't know what type of openings. It is not about opening of your vertebrae, isn't it? It is more about that how efficiently you can utilize the muscle group and the fascia to open yourself rather than utilizing the bones. This is just a bone, right? They will just follow the muscles. Wherever the muscles will be dominating, it will just follow. Okay. So work on the muscle, work on the muscles in the back. Lose something in the front, work something on the back, and you will get back the structure. Right. So, but do not expect it to move too much behind. Right. So when you're talking about heart opening, chest opening, back bending, it is not coming from here. Okay. It is not coming from here. Either it is coming from your shoulder, from your chest area, opening from on top, and when you're going into back bend, it is coming on your lumbar, not here. I will show you, your mentor will show you a lot of asanas in the box, and you will also practice that. You will see that your thoracic really doesn't move behind. It is your lumbar which is moving. Okay, not thoracic. Thoracic is designed for rotation purpose. Okay, so each vertebra on the thoracic is designed to give you 2.7 to 3 degrees each. So collectively, they give you 30 to 35 degrees. So what is 30 to 35 degrees? If it is 0, it is 100, it is 45 in between, 10 degrees inside, 35. So 30 to 35 maximum, 90, 45, 35. So this 35, it is maximum what you can get. Okay. Now you will see, you will be surprised at how, like when I move, I can move easily with my hands, like I can create 180 degrees. But yes, you're not doing it from thoracic. You're cheating, basically. Look at the access point. What is happening on the access point? Access point is not moving beyond this. What you are saying is you're watching your limbs. If you will hold sticks in your hand, long sticks, you can even create 360 degrees. Is that a right rotation? It is a correct rotation? No, it is not. It is not a true rotation. It is a false rotation, isn't it? So try to understand one thing. Thoracic area is not designed for flexion extension and this 360 degree of rotation, right? Yeah, some people which you see, whom you see like on the internet, Instagram, Facebook, social media, 5 to 10% of people in the world are highly mobile, just like any other joint, isn't it? Right? So if you are going to follow those people, definitely are going to get injuries. Okay, because those people have their range of motion which are higher than the average people, and then they're not aware of it. They're not aware of what? That other people do not have this. They think that other people can also do it if they can do it. Because maybe, I'm not saying not all, maybe they do not have the biomechanic or anatomy knowledge. Right? They just think that if they can do that, everyone can follow easily. And that's the problematic part. Right? Yes, human body can do everything, but not everything literally. Okay. There is something called biomechanics within the body. There is something called joints in the body where you will be having limitations for sure, which we say in our course as a joint compression, wall principle. Understand that Because if you will not understand that, you are going to get injuries in the joints everywhere. So whatever joints we have discussed till now, and whatever joints we are going to discuss ahead, we are going to get injuries everywhere. So to protect those joints, we need to understand the biomechanics, we need to understand the anatomy, we need to understand our capacities, we need to understand our limitations. Okay. So all the vertebrae on the thoracic can only give you rotations. That also limited rotation. Okay. So for all the rotation that you get, just make sure that you have the neutral spine, upright spine without moving back and forward, and then you're getting the rotation. Okay. No rotation when you're rounded, no rotation when you're too much into extension. Neutral spine. Okay. If you do not want to get any injury. Got it? So just practice with your mentor, and the mentor will take you through all the asanas in yoga, wherein you will see all the rotations. Okay, good. I will see you next in the lumbar part, wherein I will discuss that how you get the back bends, how you get the forward bends. All right. First, we are going to start with the back bends in lumbar. Until then, enjoy. Thank you.